So in today's section, we'll discuss about nutritional recommendation and food requirements for elderly. It's chapter 10, page number 180 in your new dietetics textbook. Page number 180. Those who have the old textbook, please refer the old page numbers from the index. So anyone if is joining late, please help them out with the page numbers or topic name. So the process of aging actually starts from the day you are born. Okay, from birth, from the day you are born, the aging process has begun. Okay, so aging, physiologically speaking, aging is associated with dynamic, that is changing with time. Dynamic means change with time. Dynamic biological, physiological, environmental, psychological, behavioral, and social processes. Okay, all these aspects of one's life changes with time, and that change in an umbrella term is what we call as aging. At a biological level, aging results from the impact of accumulation of wide variety of molecular and cellular damage over the time. This is because of free radicals. Various reactions are taking place in your body. Free radicals are released during these reactions. If you do not have enough antioxidants to combat these free radicals will go and damage your healthy tissues and cells. Okay. And when you accumulate these damages done to your body at a cellular level, by these free radicals over a period of time, when this accumulation happens, that is a significant way of showing age on your face. Okay. So aging is not a disorder, it's a biological process, it's a physiological process. Everyone has to go through that. Okay. If you want to put an age into this term, okay, when we are discussing about age groups, usually when people reach the retirement age, 60 years or above, that's what we are referring to. Those are the people who we are referring to for this particular class. When we call them as elderly, it's people who come under the retirement age group, 60 years or above. Okay. So whatever food requirements, nutritional requirements, dietary guidelines we will discuss here, it's targeted to this particular age group of people who are 60 years or above. And also certain aspects of the aging principles will also apply to women who are menopausal. Okay. Around approximately about 45 to 46 years of age. That is when Indian women, majority of the Indian women get their menopause around this particular age, 46 or 45 years of age. So aging, you have to again understand that it is not a disease condition, it's a biological process. Okay. These are the changes that happens in the, like like when it comes to the bodily functions. Okay. When it comes to the taste and smell, your taste and smell decreases with age. When a child is born, the child is born with a lot of taste buds. But when the child grows up, okay, this is the reason why uh, when you're introducing a weaning diet or in the early stage of toddlerhood or infancy, when you're introducing any food, you have to limit the use of salt and sugar. Limit, okay? It's not completely you have to avoid. You can limit the use of salt and sugar because the child already has a tongue which is rich in taste buds. Okay. So so what saltiness and sugar or sweetness that you feel as an adult, the child may feel it 10 times more. Okay. So it could cause some irritation. It is a very strong flavor for a infant. But when you grow old, when you grow up, you are losing a lot of taste buds over a period of time. Okay. So decreased number of taste buds on the tongue papillae, the decreased olfactory and taste nerve and endings present near in and around your mouth. That is the reason why you start losing the sense of taste and smell slowly when you age. Okay. Specifically, you lose the ability to detect salt and sweet. These are the top taste buds you tend to lose over a period of time. Okay. Palatability, because of this palatability, you do not feel any taste. You do not feel much strong taste in your food. And because of that reason, your appetite will also come down. You don't find anything tasty enough to eat. Okay. Second is your salivary glands. Decrease in the salivary secretion that causes dry mouth, xerostomia. Xerostomia means dryness of the mouth. The medical terminology of that is xerostomia. So there is a decreased secretion of saliva from the salivary glands, and because of which it is required for the old age people, for the elderly people to drink more fluid rich food. Okay, even when you're giving them food like soup or khichdis, something that should be in a porridge kind of a consistency, it should be a little bit semi-liquid kind of food, because you don't give them too dry food to eat, like some biscuits or something like that. It is too dry to eat. They will find it very difficult to chew and swallow, because they're already having a very decreased secretion of saliva. Gastric functions are also decreased over a period of time. You will lose your cells that secrete gastric mucus from the gastric cells, hydrochloric acid from the gastric cells, parenchymal cells, intrinsic factors, pepsin secreted by your pancreas. Okay, all these things will reduce over a period of time. So digestion becomes slower and slower, and because of the absence, or because of the decrease in the secretion of all these digestive juices, even the availability of minerals, because minerals and vitamins, they tend to get absorbed better in an acidic environment. Okay, so when these factors from the stomach are reduced, the environment is not as bioavailable for the minerals and vitamin absorption. Okay, specifically vitamin B12 and folate and iron absorption decreases with aging. Teeth, loss of teeth and wearing of dentures is very common. Small intestine, the pH of the small intestine becomes more alkaline, as I mentioned earlier. The acidic factors from the gastric juice, when it decreases, the alkaline factors increases. The pH gets higher and higher. It becomes more basic, more alkaline in nature, and because of which it is a very good environment for your bacteria to grow. Okay, when the intestine is alkaline in nature, that could lead to a lot of malabsorption. Okay, it could also lead to poor calcium absorption, poor uh, uh, lactose intolerance. Vitamin D absorption will be decreased, and because of these two factors is why old people in their old age, they suffer from a lot of bone related issues. We will discuss that, like osteoporosis, osteomalacia is quite common. Hip fractures, fractures of the weight bearing bones like your femur, your joints, okay, your ankles. These fractures are very common in elderly people. Reason being, these are the weight bearing bonds of your body, and they have to carry the weight of the person. And if their diet is less in calcium, less in vitamin D, or if the intestines are not able to absorb vitamin D and calcium, automatically the bone health will deteriorate. And first of all, the non-vertebral bone, that is the weight-bearing bones of the body, will start to uh, break. Even without a fall or something, small cracks, minute cracks may happen. Liver and the biliary function decreased in the size and the blood flow of this major organ, and even in the gallbladder, it becomes the emptying of the gallbladder becomes sluggish, which means as soon as food enters your stomach, your gallbladder has to empty the bile juice that it has collected from the liver. Okay, liver secretes the bile juice. Gallbladder collects it. Gallbladder is a pouch that collects the bile juice. And as soon as the stomach gets the food, the gallbladder is supposed to empty this bile juice, okay, through the biliary tree into the duodenum. Okay, so that's how it functions. But with age, the emptying of the gallbladder, okay, it becomes very slow and sluggish, and it means a lot of bile juice is left back in the gallbladder. Complete emptying of the gallbladder has not taken place. So what happens? This bile juice that has left behind over a period of time, it becomes bile stones. Okay, it increases in its concentration and it becomes bile stones. That's how you get gallbladder stones, and gallbladder surgery has to be done. Okay, and also the drug metabolism of the liver falls down over a period of time. Okay, so these are the major changes in the organs that takes place. Even the metabolic function, impaired glucose tolerance, and why not just glucose tolerance but also lactose intolerance. Okay, the enzymes that are supposed to break down the macros, like your lipase as well. Okay, lipase is supposed to break down the lipids from the pancreas. Lipase is secreted. All these secretions will be decreased, so the metabolism falls gradually. Neurological function, state of confusion, high risk of Alzheimer's, Parkinson's disease, dementia. When the gallbladder is not able to empty the bile juice properly, some part of bile juice is left behind in the gallbladder. Over a period of time, the concentration increases and it becomes gallbladder stones. When you are a healthy adult, gallbladder stone can happen even in young people. We are seeing young people also with gallbladder stone, but usually it was something that was associated with elderly. Okay, but it can happen in young people as well. If there is a family history of gallbladder stones, there are high chances it can happen in young people as well. Immunological competence declines with age, but if you are doing some supplementation, okay, like zinc supplementation, essential fatty acid supplementation, polyunsaturated fatty acid, vitamin E supplementation, if it is going on, then you can still increase your immunity a bit. Ophthalmic function, that is your eye. Okay, vision and opacity of the eye lens deteriorates over a period of time. Okay, and just add more antioxidants in your diet. You can, it's a it's not a curative treatment. Having more antioxidant to better your eye health, it is not a curative treatment, it's more of a preventive treatment. Cardiovascular function, the blood vessels become less elastic, and also the total peripheral resistance of your blood vessels increases. And this is the reason why you have a high chance of being hypertensive, high BP, okay? And there are high chance of cholesterol. Am I audible? Is my screen visible now? Okay. So the cardiovascular system, your blood vessels lose their elasticity over a period of time. Okay. And because of which the blood pressure hits differently on your blood vessels and you become hypertensive. Renal function, the GFR rate, glomerular filtration rate, the rate at which the kidneys are able to filter out your blood and produce urine, okay, that decreases by 60% when you age. Okay, so the way how protein, the risk of proteinuria, sodium potassium electrolyte imbalance, okay, these things are affected in elderly. So these are the changes influenced by nutritional requirements. Most of them are preventive, it is not curative. Okay, certain parts of it is it's a management. It cannot cure. For example, reduction in saliva. The curative part would be, the management part would be drink more water. Maybe there are high chances that a person, an elderly who is suffering from dry mouth, okay, there are high chances the person is also dehydrated. Okay, so when the person is dehydrated, encourage them to drink more water. There could be a chance that the salivary function, the saliva secretion will be back to normal, but still you have to encourage them to drink more liquid diet, semi-liquid, liquid diet, because elderly people, they do not have thirst mechanism. They don't understand thirst mechanism. They feel less thirsty over the period of time, even if the body is dehydrated. Okay, but ensuring that their main meals are also more into the liquid side, more into the semi-solid, semi-liquid side. It means that you are adding more water into their body. Okay, so that is one treatment from nutritional management aspect of repairing your salivary secretion. Cardiovascular, your blood vessels loses its elasticity over a period of time. Okay, your blood vessels has a vitality, has a elasticity nature to it when you are young. Okay, this elastic nature of the over a period of time, the blood vessels become looser and looser. Just to put terms in your perspective. Okay, so it is very easy for your blood vessels to get manipulated by increased cardiac output. Okay, or increased blood volume. Why increased blood volume is that there are high chances that the person's renal function is debilitated. Okay, the kidneys are not functioning well. So the elderly person may suffer from edema. If the person is suffering from edema, high cardiac output, because a lot of water and fluids are retained in the body, which means the blood volume will be high. On top of that, the blood vessels is not elastic enough to pressure it down. Okay, so the blood vessels are taking up all the pressure of this increased cardiac output. Okay, that's the reason why a person becomes hypertensive after a certain age. Okay, post menopause, it may affect the woman also in the similar pattern. Is it clear to all? Post menopause means after menopause. Woman who has attained menopause. Menstruation has stopped. She is no more in the reproductive age group. Okay. Usually for Indian women, it is about the age of, it could be different. It's very subjective. Even till 50, certain women can still menstruate. Okay. So when the menstruation stops, that's what we call as a post-menopausal woman or post-menopausal age. Energy requirements, you can check the table 10.3. Okay, energy requirements 10.3 and 10.2. Those who have the new textbook, it's on page number 184. Okay. So based on this particular energy requirement is only for men and women who are above 60 years of age, given by ICMR, and this is the Indian elderly. Okay, it may not be true for the elderly who are from other ethnicity or other race. Okay, this is given by ICMR, so this is only for Indian men and women who are above 60 years of age. Okay, table 10.3. In old textbook, it was table 10.2. New textbook, it is table 10.3. Okay, for example, if we take a male whose weight is around 60 kg, male whose weight is around 60 kg, okay, and this person has a very sedentary lifestyle, what would be the energy requirement on a daily basis? Based from the table, you can answer in the chat box. A male who is 60 kg, sedentary lifestyle, what would be the energy requirement? Yes, 1625. So this particular table you can use even without doing the entire calculation of finding BMR and then finding the weight management, calories, okay? Even without that, if you just focus on this table, okay, based on the different body weight your clients are, if you are dealing with an elderly client who is about 60 years of age, okay, based on this table, you can make a diet chart for them because the calories what you have to use is already given. Is it clear to all how to use this table? BMR, we have a separate formula. BMR, there is a separate formula. Those who remember the chapter, please mention the chapter name in the chat box. Again, the chapter will be taken. BMR formula will be taken all over again when we discuss the chapter of obesity, diet in obesity. PAL value means physical activity level value. PAL means physical activity level. It means, are you having a sedentary life? Are you having a moderate life? Okay, moderate activity, okay, or a heavy activity. That is the PAL value. BMR formula is completely different. St. John and Mifflin formula is also different. When you incorporate the PAL value into the BMR, multiply the PAL with the BMR, that's when you get the St. John and Mifflin formula. Okay. Total energy expenditure. TEE means total energy expenditure. Means the total calories that you require for that particular day, entire day. Okay. Calories per day, kilocalories per day. That is total energy expenditure. So carbohydrate should give you around 50% of the calories. Carbohydrate, whatever is the calories for like based on their body weight and based on their activity level, whatever calories you have come up to. For example, let's say the 1625 kilocalories, okay, for what you have checked for a 60 kg man who has a sedentary lifestyle, okay. What would be the amount of calories carbohydrate should give you here? You can use a calculator. 1625. How much calories do you expect carbohydrates to give you throughout the day? Yes, 812 calories, approximately 800 or 850. You can go up to 850 as well. Okay. Yes, for every, this is a generalized, this carbohydrate requirement is generalized. Okay. Even if you are a diabetic patient, even if you're dealing with a diabetic patient, 50% of the calories should still come from carbohydrates. Okay. 1700 kilocalories is given in table 10.2. We were discussing table 10.3. Okay. 1700 kilocalories for all the men. You cannot declare that as a general calorie requirement because it is completely based on their BMR. Please focus on table 10.3. So at least 50% of the calories should come from carbohydrates. Even if you're diabetic, If you're non-diabetic, if a person is non-diabetic, at least 55 to 60% from the carbohydrate they can still have. Okay. In case of protein, protein requirement will be judged only by a nephrologist if the person suffers from some chronic kidney disease or any nephrological conditions, kidney conditions. Okay, in that case, the nephrologist will decide how much salt intake should be maintained on a daily basis and how much protein intake should be maintained on the daily basis. And based on that guideline, what you have received from a nephrologist, you can prepare a diet plan. Usually, the clinical dietitian who is present in the hospital, they themselves will create a diet plan and give it to the patient. Okay. So you have to be very careful to when it comes to carbohydrates. First, understand if the person is having hypoglycemia or hyperglycemia, and if the person has type 2 diabetes, if the person is insulin resistant, all these things have to be checked. And based on that, you have to formulate a diet plan for them. If the person is prone to hyperglycemia and insulin resistance, add more complex carbohydrates, give them the option of only complex carbohydrates, take away all the simple carbohydrates and fructose. Okay, high fructose rich fruits should be taken away from the diet. Low fructose fruits can be added, diabetic friendly fruits can be added. When we will discuss the chapter on diabetes, we'll discuss all these foods in detail. Okay, even insulin resistance and everything we will discuss in detail when we take the diabetes class. For this particular chapter, it's not required much. Protein requirement for elderly, 1 gram of protein per kg body weight. Whatever is their body weight, multiply by 1. Okay, so 45 is the body weight, 45 gram of protein should be taken. 60 is the body weight, 60 gram. Okay, you can't give them too much of protein here because with age, the renal capacity decreases, glomerular filtration rate decreases. So too much protein in the diet will cause more harm to them. It can lead to protein hematuria. Okay, protein in the urine along with that blood in the urine, it can lead to that. Okay, so be very careful about protein intake in elderly. Do not overdo it. Okay, and even the calories that come from protein should be between 11 to 12%. Just like how carbohydrate should give 50% of calories for diabetic patients, 55 to 60% of the calorie for a healthy person, healthy elderly who is not suffering from diabetes or any glucose intolerance. If the person is not suffering from any glucose intolerance, then they can still go up to 60% of calories coming from carbohydrate. Okay, but it's better to give them complex carbohydrates irrespective of their diabetic, if they're diabetic or not. Okay. Similarly, calories from the protein should be around 11 to 12%. Lipids, specifically omega-3 fatty acid, total dietary energy that comes from lipids can be around 30 to 40%. If the person is active, is having a moderate to active life, then only they can tolerate up to 40% of energy coming from lipids. If they have a sedentary life, okay, please reduce it only up to 30% of the energy coming from fats. Okay, and make sure saturated fats and trans fat should be reduced. Saturated fat means using coconut oils, using ghee, okay, butter. They have a lot of saturated fats, so you have to reduce that. Instead, you can use vegetable oils more, seed oils more. Okay, if you are using coconut oil, use the virgin coconut oil to drizzle over the food. Okay, that is better. Omega-3 fatty acids supplements will do better. Okay, if the digestive system is impaired, supplements can do better. Supplements work better for elderly because it will not take too many chances to be absorbed. Okay, instead of getting vitamins and minerals from the food, okay, absorption is deteriorated in elderly, so they do better with multiple vitamin supplements. It's for healthy adults. Okay, 8.3 gram of 8.3 gram per kg body weight per day is for healthy adults, and especially for people, healthy adults who have a sedentary lifestyle. Okay, we are taking the class on elderly. So this is what they have mentioned in the textbook. Person who is above 60 years of age. So minerals, focus should be on calcium. Calcium needs during old age increases because there is a high risk of osteoporosis, specifically for women who are above 50 years of age, or who are menopausal, who are going to attain menopause, or are the menopausal age group. Okay. And specifically if they are not on HRT, women who have started their menopause, initially they will be put on HRT, hormonal replacement therapy. So if they are not getting their HRT or estrogen supplements, they will require more calcium supplements. Okay, because that if estrogen, in the absence of estrogen, demineralization of the bones takes place at a very accelerated rate. Okay, so to overcome that, calcium supplements are important. Women who are over 50, at least you have to maintain. HRT means hormonal replacement therapy. Women who are over 50 years of age, 800 mg of calcium per day is required at least. Usually we say 1000 for adults, but at least 800 should be there in their diet. So, and calcium, why calcium is available only from a very limited amount of food. Other fruits, vegetables, cereals, pulses, everything has calcium. But when you are looking out for a best source of calcium, there are only few limited options you have. And it is also supposed to compensate your age-related bone loss. With age, you are losing your bones. Okay, you are losing the minerals from the bones. But on top of that, for women, when menopause hits, it doubles. The way how women will lose their minerals from the bone will be triple the rate at what a man may lose the bone from the at the same age. Okay, and also to prevent fractures, tooth decay. Okay, so for all these functions, calcium supplements are required. And also for your heart health, calcium enables your heart to contract and relax. If you remember from the classes of calcium which we have done for previous batch, for the heart to contract and relax, for all your muscles to even to contract and relax, calcium is required. Okay, and the blood also has to maintain a certain level of calcium homeostasis. That is, calcium balance should be there in the blood. Okay, so for all these reasons, calcium supplements or calcium rich food is important for elderly. Milk is one of the important source of calcium, which works perfectly for elderly as well. And other minerals like iron deficiency is also very common. Anemia is common in elderly. Blood loss because of any surgery or any non-heme related iron absorption issues. Okay, any alcoholism issues, lack of vitamin C in their diet. These all will lead to impaired absorption of iron, and that leads to nutritional anemia. So iron supplements can also be given, but don't take both the supplements. Calcium supplements and iron supplements should not be taken at the very same time. Lactase tablets are available. Okay, specifically those who are lactose intolerant. And milk, you are a vegetarian and you do enjoy milk, but you are lactose intolerant, you can take a lactase tablet for that. Okay, lactase tablets, it means it has that lactase enzyme. You can take that before you have milk. Okay, and it will not give you issues. Or you can replace milk with curd, buttermilk, but any dairy product. In short, any dairy product. Cheese also has lactose, so even if you're indulging in anything that is cheesy, inform them to take a lactase tablet. Lactase tablet should not have any side effect, because the entire content of the tablet will be used up just to metabolize lactose. Okay, so it should not give any side effect as such. As soon as you have the lactase tablet and immediately you have your dairy product, it should not give you any side effect until and unless there is any other contraindication of using milk in your diet. Once you have to identify, are you lactose intolerant or not. It is done by certain test, and after that test, based on the doctor's guidelines, they will give you the lactase tablet dose and everything what you require. Zinc supplements is important for elderly for their immune function. We have discussed that earlier as well. Zinc supplements, vitamin E supplements are good for immunity. So coming to vitamins, vitamin D absorption, it decreases with aging, and also after a certain age you go out less. Elderly do not have much energy to go out or be in the sunlight, so that also is one of the reason why their vitamin D uh, absorption decreases in their body. And inactive form of vitamin D is more prevalent in the body as compared to active form of the hormonal vitamin D. Okay, so these also lead to a lot of fractures and bone related issues, the absence of vitamin D, insufficiency of vitamin D. And because of that, calcium absorption is also affected. If vitamin D is not present in good amount, calcium will not be absorbed well. Okay, in the presence of vitamin D, calcium gets absorbed well. So elderly should also be recommended to go out in the sun, take a morning walk, take a evening walk when there is when there is still sunlight. Okay, do yoga, etc. out in the sun, but not after 8 a.m. or after not after 9 p.m. when the sun rays are harsh. That would lead to dehydration. Okay, so encourage them to at least spend 1 hour out in the sun. And vitamin D deficiencies can definitely be maintained using vitamin D supplements. For vitamin D supplements, we have discussed that in one of the pediatric nutrition class. Uh, those who have attended that, they could remember. If you get the vitamin D supplement, okay, the cholecalciferol supplement, if you take that toned milk, the milk made that you use for kheer or making any sweet, I guess you know the condensed milk. Are you aware of that condensed milk that we get from the market? If you take that 200 ml of condensed milk, okay, and in that just put 1 packet of that vitamin D supplement, okay, mix it well and keep it, and daily just have 5 ml of that condensed milk. It is very tasty to have. It has a very toffee like caramelized flavor to it. Okay, everyone enjoys having that. If you are not diabetic, definitely you can have that. Okay, so just finish that entire 200 ml in 15 days. Just have 5 ml of that on a daily basis. uh, Put this vitamin D sachet in that 200 ml of condensed milk, and on a daily basis just have 5 ml of it. Either take it in milk, put it in milk, mix it in milk, and have that glass of milk, or just have it in a spoon and enjoy that taste. Okay, or have it in any of your beverages or drink which you want to add a more toffee flavor to it. Okay, that is the reason why I'm suggesting only have 5 ml of it. 5 ml of condensed milk will not be that does not have that high sugar. So if you're diabetic, avoid this. But if you're non-diabetic, okay, one packet of vitamin D. Just 1 packet of vitamin D in 200 ml of condensed milk. Or you can do second thing, that is vitamin D supplement. You can add even in 2.5 kilograms of your wheat flour, atta. Okay, 2.5 kilograms of wheat flour. You can add vitamin D sachet into it, mix it thoroughly, and use it. Use it how you use it on a regular basis. That can also increase your vitamin D intake.
Vitamin D supplements which are given by the doctor. Okay, so these are prescription based supplements. Usually what happens with vitamin D supplement is that the doctor will give you one supplement per week based on the level of vitamin D deficiency you may be suffering from. Okay, if it is mild to moderate to severe. So for if it is severe vitamin D deficiency, for 2 to 3 months weekly you will have to take the vitamin D supplement. Okay, that's sachet. But if you forget, because weekly once you're taking this particular dosage, right? So if what if you forget someday? So that is the reason why even people who are not deficient, but because of your lifestyle, you may not be physically active, or you're not getting enough amount of sunlight. Okay, so all these factors come into play when you are making a decision. So just visit your physician and ask them for the vitamin D tablets. If they ask, if there are a test on you, go for that test, do the blood test. You will understand what is your vitamin D status. Okay, so if at all you're getting the prescription of this sachet, get one sachet. Do not overdose it. Just empty one sachet in one bottle of the 200 ml of that condensed milk. Mix it well daily. Don't have more than 5 ml. Okay, just 5 ml, one spoon, 5 ml of that condensed milk. Either add it in milk, whatever beverage you drink. Okay, don't add it into any caffeinated drinks, coffee, tea. Don't add this condensed milk into that, because it will not help in the vitamin D absorption. Okay, even for kids it is completely fine. It's best for kids. Uprise D3, if it is available with certain chemist shops or pharmacies are selling you without prescription, you can try that. But without prescription is dangerous. Do not overdose yourself. Do not lead your children into toxicity. Please keep that in mind. But this is one of the very easiest way to make sure that your vitamin D intake is good, specifically for vegetarians. Okay, vegetarians. So that was just one tip for vitamin D. Vitamin E is also a potent nutrient. It is also it is also known to improve your immunity. So vitamin E supplements are also good for or elderly. It also protects your DNA from damage, and if your DNA is protected from damage, the risk of cancer decreases. Vitamin K, certain studies they have done in people who have early stage Alzheimer's. It has seen that they were deficient in vitamin K. So there is some relation of vitamin K and getting Alzheimer's. Okay, so check that. Don't completely believe that there is just we do not have a confirming medical evidence based study. It's just few studies which show the relation between vitamin K deficiency and early onset of Alzheimer's. So try to add more green leafy vegetables in your diet. Enough supplement of vitamin K can prevent your chances of getting Alzheimer's to an extent. Okay, it will not cure. It may prevent. Vitamin D tablets may come in different forms. Okay, it may come in different forms. If you're getting it in powder form, it is much more easier to mix up with the atta flour. Otherwise, when it comes in that granules, okay, it comes in a granule form which you have to mix in milk. Okay, that is better used for the condensed milk tip. Okay. B vitamins, try to add more multigrain rich food, whole grains, whole cereals and pulses in their diet. Try to avoid white rice. Try to avoid polished rice. Give them more parboiled rice. Vitamin C, again, add more fruits, yellow, orange fruits. Add more capsicum based diet, green leafy vegetables. And if you are using green leafy vegetables, please add tomatoes also in whatever preparation you are making with green leafy vegetables. That will enhance the absorption of minerals and vitamins from the green leafy vegetables. Only if you have blood clotting disorders, okay, there are specific disorders, cardiovascular and blood related disorders, in which green leafy vegetables have to be avoided. Okay. Vitamin K is supposed to clot your blood. If you have any blood clotting disorders, the physician will guide you not to use dark green leafy vegetables. Okay, there are certain medical conditions in which physician will guide you through that. Okay, specifically it is the blood clotting disorders in which vitamin K based diet has to be avoided. Okay, so certain green leafy vegetables which have a higher demarcation of vitamin K, that will specifically be avoided from your diet. For others, having green leafy vegetables on a daily basis is a good choice. If you do not have this blood clotting disorder in your family, it does not run in your family, you can definitely have green leafy vegetables on a regular basis. Specifically, people who are on aspirin and all for a pretty long time, they may suffer from certain blood clotting issues. Water, minimum 2 liters of water, which includes all your beverages as well, and also the water which is present in the food like soups and all. And for 2 liters of water, they have mentioned 1.5 liters of water. That don't confuse it. That 1.5 liters of water is the minimum required by your kidney to function well. Okay, that is the minimum requirement by your kidney to function well. 1.5 liters of water on a daily basis. So you should have at least 2 liters of water to make sure that toxins from your body is being excreted by your kidney. Okay, detoxification is taking place through your kidney. So this water can be consumed also in the form of fruit juices, porridges, liquid diet, soup, buttermilk, milk, to prevent constipation. Okay. Coming to fiber, for elderly, 30 grams per day of fiber is ideal. Don't go more than that because it will increase your gastric motility and it may cause malabsorption of nutrients and vitamins. So those who are suffering from diabetes, fiber-based diet is a really good way of controlling your glucose levels, blood glucose levels. Have more mature vegetables is not advised for aged people. For young people, you can have the mature vegetables, that is not the tender vegetables, the mature ones in which has higher the amount of fiber. Using isabgol is also a good way to increase your fiber intake. That is the psyllium husk, isabgol. Antioxidants. Every vegetable, for example, if you take okra, lady finger, okay, the bigger ones, if you have ever come across the bigger ones, the older ones are much more difficult to be chewed and swallowed. So that's an example of a mature vegetable. Okay, every vegetable has its tender stage and its mature stage. Okay, so in elderly people, tender vegetables are what we encourage them to have for fiber intake, not the mature vegetables. Mature vegetables means the one that is older. Okay, it has been on the plant for a pretty long time. Okay, and it was plucked much later. Tender vegetables, they cook easily. The one that have just bloomed, the ones with tender fruits and vegetables are the ones that they have just bloomed recently. Okay, that is tender. Yeah, kind of baby vegetables that are very easy to cook. Okay, Mature vegetables take longer time to cook. Young potatoes are very easy to cook. They boil very quickly. The older ones, they may take much more time to cook. Antioxidants. Antioxidant supplements can be taken. If not, vitamin C is a great antioxidant. Vitamin E, B12, folic acid supplements, they also have antioxidant functions. Okay. Flavonoids from tea, they are also a good antioxidant. Curcumin from turmeric. Okay. Consumption of foods that are rich in antioxidants should be much more preferred than supplementation. But if they are in an extreme old age, then supplements will work better. Specifically in diseases like diabetes, atherosclerosis, hypertension, cataract. Okay. Green tea has antioxidant, but there are better antioxidants present in fruits and fresh fruits and vegetables that can do much better than what the antioxidant present in green tea can do. Okay. Yeah, the tender vegetables are better because they're easy to cook. Their fiber content is also good on the stomach, good on your GI tract. Mature vegetables usually trap the food. The fiber present in mature vegetables do not allow the nutrients to be absorbed by the intestine. Okay, so young adults can tolerate mature vegetables better because they still have a good gastric motility, but it's not the same case with older. When we will discuss the chapter of antioxidants, we will discuss this in detail. There's a lot of food which are rich in antioxidants. All your fresh fruits and vegetables are great sources of antioxidants. Specifically, when it comes to fruits, all the okay, the small fruits, mulberries, blackberries, blueberries, strawberries, okay, all these berries which are rich source of vitamin C and other antioxidants. So is it clear about the nutritional requirements? Now coming to the food requirements. Soft and easily chewable food should be given, specifically for people who have dentures, who do not have teeth. Okay, they have lost their teeth. Specifically for that, soft, easily chewable food should be given. Easily digestible food, because with age we have seen there is a decreased production of digestive enzymes, hydrochloric acid, lipase, lactase, or even the mucus present from which are present in the intestine, pepsin. Everything decreases over age. Fat should be restricted in diet, but polyunsaturated fatty acids should be added. Usually, polyunsaturated fatty acids are found in vegetable seed oils. Okay, they are good sources of fat for elderly people. Specific because elderly people are susceptible to atherosclerosis, heart diseases, okay, cholesterol diseases. So if you decrease your ghee intake and butter intake after certain age and depend only on vegetable and seed oils, it is much better. Give some examples. Students can give some examples of seed oils, vegetable seed oils in the chat box. It's very easy what you use in your kitchen. Mustard oil, sunflower oil, sesame oil, peanut oil. So these are your vegetable seed oils. Okay, they are good sources of polyunsaturated fatty acid. Ghee has cholesterol. Ghee is from animal product. Ghee is an animal product. Okay, butter, ghee, they are from animal product, so they have cholesterol. Okay, vegetable oils do not have cholesterol. Mixed oils are better. Mixed oils give you a correct indication of the correct ratio of omega-3 and omega-6 fatty acid. That is the reason why mixed oils are used. Okay. Coconut oil is a saturated oil. Coconut oil is a saturated oil. Those who have cholesterol issues, coconut oil will not be well tolerated by them. Okay. Coconut oil, butter, ghee, okay, they all are saturated fats. So those who have cholesterol issues, they have to reduce their consumption of this. Vegetable oil is good for people who have a history or family history of heart diseases. They should stick to vegetable oils. More, reduce your, it's not you have to completely avoid, reduce your consumption of ghee, butter, coconut oil, etc. Okay. Bran oil is also fine. Focus on more MCT and PUFA. PUFA is polyunsaturated fatty acids, and MCT is the medium chain triglycerides. Then we will discuss on the chapter of lipids. We will discuss all these factors in detail. Okay, which oil is good, which is bad, for which age group, which particular oil is better. Okay, we'll discuss all these in detail. Okay, so remember this thing, cholesterol is only found in animal-based products. Plant-based products, plant-based oils do not have cholesterol. Okay, so if you suffer from cholesterol issues, if your family members suffer from cholesterol issue, animal-based oil, that is butter, ghee, okay, any animal-based oil, any cow ghee, buffalo ghee, nothing matters, all are same. Animal-based oils and fats has to be avoided. PUFA stands for polyunsaturated fatty acid. Okay. All these abbreviations in detail we will discuss in lipids chapter. Fiber-rich food has to be given to prevent constipation, to reduce cholesterol levels, and also to reduce the blood glucose levels. Try to restrict caffeine as much as possible, because overstimulation can lead to sleeplessness, insomnia, irritation, and also it will decrease the gastric absorption of nutrients. Try to liberally use green leafy vegetables if it is not contraindicated. Try to liberally use green leafy vegetables. Liberal use means on a daily basis you can use green leafy vegetables. Okay. And try to give more calcium-rich food like milk, curd should be given to compensate bone loss. And curd can also act as a probiotic. Okay, having curd can act as a probiotic. It can stimulate your intestinal flora, intestinal bacteria to grow, which can lead to healthy digestion, healthy gut. Familiar food should be given. Do not change the cuisine. Do not change the food that they were used to having all these years. Give them familiar food that is easy to accept. Clear soups in the beginning of the meal, that will aid digestion, that will also solve their thirst issues. They will keep, it will also keep them hydrated. It will solve dehydrations also. Small and frequent meal is good, even for people who are diabetic or non-diabetic. Small frequent meal is better than giving them one heavy or 3 heavy meals at a go. A glass of warm milk before they go to sleep, that it has a calming sensation. It will increase the calcium intake as well. Okay, and it relaxes. Warm milk before bed can relax the person and it can induce a good sleep. Heavy meals should be given at noon. Keep the dinner as light as possible. The heaviest of the meal, whatever is the calorie intake, okay, even if it is 1,500 kilocalories per day, but the majority of the calorie what the person is going to take, it should be in the noon during the lunch. Okay, breakfast and dinner you can keep it light. Usually if it is an elderly person, he or she, if he's a retired person, Okay, you can definitely keep the breakfast light because they will not be doing much activity, strenuous activity throughout the day. So breakfast can be light. Very light meal at night. Don't give heavy meal. The sleep should not be disturbed. Avoid too many sweets that could lead to cholesterol and tooth decay, indigestion, obesity, blood glucose level issues. Plenty of fluid to prevent constipation and dehydration. Consumption of flax seeds, at least 40 gram of flax seeds on a daily basis. And flax seeds not just for elderly, even for young adults, young women who suffer from severe dysmenorrhea, painful menstruation. If you are a vegetarian, try to consume flax seeds on a daily basis. You may note a change in the menstruation, the symptoms of menstruation, the symptoms of PMS and everything will slow down a bit. It will not resolve, it will not slow down, but you will definitely see a change. What omega-3 fatty acid can do for your menstrual health. Okay, this applies for even for post-menopausal women. When you roast any seed, okay, seeds consumed in their raw form is much better, but when you roast any seed, certain aspects of the nutrients are lost, but roasted seeds are much better to use in terms of flavor profile. Okay, so if you do not like the flavor of flax seeds at all, you can go for the slightly roasted version. Roast it, powder it, okay, and then as soon as you have done your cooking, when you have turned on off the stove, whatever you have mixed or prepared like dal or sabzi or whatever, when you are serving it, just add this 2 to 3 teaspoons of powder over whatever you have prepared. Okay, that is the best way of incorporating flax seeds without knowing the taste of it. If you do not like the taste of the flax seed, this is the best way of how to incorporate it. You can make the flaxseed laddus as well. Okay, flaxseed laddus also you can make that. The recipe, I had shared this recipe with the previous batch students. If you also want the recipe, you can just WhatsApp me. I will forward you the recipe of the flaxseed laddu. Along with flax seeds, other seeds are also added. Jaggery or date can be used as a sweetener, not sugar. Okay, so you can WhatsApp me. I'll forward you the recipe of that. Those who want the recipe of flaxseed laddu. Yeah, flax seeds are for omega-3. Specifically for vegetarians. For non-vegetarians, you can definitely eat fish. Fish is the better source of omega-3 than flax seeds. But if you're a vegetarian and you want to incorporate more omega-3 in your diet, you can go with these recipes. Okay, if you want the recipe of the flaxseed laddu, along with other seeds, which is really good for hair health, hair, skin, nails, and your general vitality for men and women both. For women, this focuses on your iron intake as well, because in the recipe, I have added both jaggery and date. Okay, if you have date syrup, or you can find dates, ground it finely and then have it. It is a really good source of majority of your vitamins and minerals. Okay, 40 gram per day you can have. Other dietary guidelines they have given on page number 191, few points they have mentioned. You can read that. For example, avoid empty calories, that is soda, Coca-Cola, drinks. Okay, these are empty calories. Food that is rich in protein, vitamins should be included. Vegetables and fruits as much as possible, liberally give them at least 5 servings of it. Okay, so fat, if they are sedentary lifestyle, only 25 gram of fat is enough. Otherwise, if they are active, 30 to 35 they can have. Gas forming food which has sulfur, for example, all your cruciferous vegetables also has a lot of sulfur. Reduce it. Soft and well-cooked food should be given. It should be less salty and spicy. Do not give them too much of fried food. Caffeine should be limited. It cannot be completely avoided. You can just limit the caffeine intake just to 2 cups per day. Okay. High fiber diet with a lot of greens and whole grains should be given. Steamed food instead of sauteed food. Okay, steamed food. Even vegetables, if it is steamed and then you temper it slightly with such a certain seasoning, it's a really good way of adding more nutritious food. Plenty of fluids, 2 to 3 servings of low-fat milk in form of milk, curd, or buttermilk should be given. Omega-3 fatty acid on a daily basis, they have to take it. Supplements if needed, for example, vitamin B12, vitamin D supplements, because if they're vegetarians, they have to focus on these supplements. And all the other habits like tobacco chewing, smoking, meatless chewing, these habits has to be curbed. I haven't tried that. I haven't tried flax seeds with milk. I'm not sure of it. You can check online if it's a viable option. Okay. So nutritional problems. Osteoporosis, common in women and men equally, but in women, it accelerates after menopause. So osteoporosis, we will discuss in detail when we will discuss about vitamin D. And also in one of our diseases class of Wednesday, we will discuss about osteoporosis in details. There is a slight spelling mistake here. 2P I have added. You can overlook that. Sarcopenia is another disease condition in which you lose the muscle. Okay, that happens to everyone in old age. You lose your skeletal muscle mass. The muscles become thinner and thinner. Okay, you become more leaner and leaner. Along with losing your fat, you lose a lot of muscle mass as well. That is called as sarcopenia. It's a natural process of aging. Okay. Obesity. Yeah, and also there is one self-assessment for women. Self-assessment for women, you can do that even right now if you want to check what is your osteoporosis self-assessment for women, not for men, for women. Just see what is your weight in kg, whatever is your weight in kg minus your age. For example, let's say if your weight is 65, okay, 65 kilograms is your weight, and you are 35 years old. So 65 minus 35. Whatever you get, the answer divided by 5. Okay. You get a single digit number or a double digit number at the end. Okay. So this number will indicate the risk of osteoporosis in women. Okay. So did you understand the formula? First, you have to subtract your age from the weight. Then you have to divide this answer by 5. Wait, I have put it in the chat box. Weight in kg minus your age. Then whatever you got the answer, divide by 5. Okay, whatever is the answer, if you have your answer in negatives, minus 20 to minus 4, it's negative, you have a high risk of osteoporosis. Okay. If your answer is in minus 4 to minus 1, moderate risk of osteoporosis. If your answer is minus 1 to plus 20, that is positive 20, you have a low risk of osteoporosis. Okay. Minus 20 to minus 4 is high risk. I have mentioned in the chat box. -4 to -1 is low risk of osteoporosis. If your answer is between -1 to +20, that is +20, you have low risk. Sorry, the other one, the -4 to -1 is moderate risk. So whoever has got above -1, if it is a positive answer, okay, if you have got positive digit, so far whatever answers I have seen is it is in positive digit, it's not in negatives. Okay, so all of you have low risk of osteoporosis. Okay, so this is based on your age and your weight. Okay, osteoporosis, the risk of osteoporosis multiplies with obesity. That is the logic behind this formula. Okay, women who are obese, they usually tend to have a lot of hormonal issues. If the hormones are in a vary, you will be at the risk of osteoporosis. Okay, so when you are getting negative answer, when you are getting any answer in negative, it means your weight is much higher than your your based on your age and your weight. There is a relation. If the answer you get that is in negative, it means you are overweight. Okay, so that could be a reason of why this formula has been formulated. Okay, that is one of the reasons why osteoporosis is associated with women who have a heavier body. Is it clear now? No, this is only for women. This is not for men. This is only for women. You will find this formula on page number 195. The other way to determine, the scientific way to determine your risk of osteoporosis is you can go and get the DEXA test done. Okay, dual energy X-ray absorptiometry, DEXA scan. This is the bone densitometry scan. You can do the DEXA scan done. Dual energy X-ray absorptiometry is the full form of it. Bone mineral density can be checked. For the treatment of osteoporosis, you will be put on calcium, vitamin D, calcitonin, and other estrogen medications. If you are a woman, you will be put on hormonal replacement therapy as well to treat your osteoporosis. Women who are menopausal, specifically them. And women who are malnourished women, they will also have. It's a correlation between your weight and your age. Only that is the only way through which you will get a negative answer. Okay, either you are extremely malnourished or extremely obese for your age. Okay, extremely malnourished or extremely obese for your age. In that case, your osteoporosis risk increases. In malnourishment, definitely, if malnourished women definitely have a higher risk of osteoporosis. For example, a 55-year-old woman who is suffering from malnourishment, she is just 45 kg. Okay, 45 kg and 55 is her age. So definitely it's a case of malnourishment. Malnourishment means not just calcium or vitamin D deficiency, all the other deficiencies she may be suffering. Okay, she will be suffering from all the other deficiencies as well. So here you will get an answer which is negative. Okay, majority of women who are postmenopausal and malnourished, you will get an answer which is negative. Yeah, for underweight people, it will be also negative. Apart from that, osteoporosis is also related with obesity. The risk of fractures happening in in women who are obese and who suffer from osteoporosis is much higher than women who have lower body weight, because in if the fractures are happening in a woman who is suffering from osteoporosis, it mainly happens in the weight bearing bones. Okay. So is the formula clear to all? You can find the formula on page number 195. Osteoporosis self-assessment tool for women. Okay. If you have to, if you get an answer which is negative in negative, please please go and fire check your bone density through a DEXA scan. Okay. Consult a physician, consult a orthopedician. Through that, you will get much better insight of your health condition. Next nutrition problem is obesity. Osteoporosis in detail we will discuss in vitamin D class. Okay, there we will have to take it in detail. And also in one of the diseases class in Wednesday, we'll take that in detail. Obesity is more pronounced in women as compared to men, obesity issues with aging. So height decreases because of osteoporosis. So you must have understand that you tend to get shorter and shorter, okay, in height, and your weight increases. And some of the elderly women who are obese because of the consumption of calories has not decreased, even though their calorie requirement is steady, or they have decreased their calorie requirement, but their weight is not decreasing. Okay. So this is because of sedentary lifestyle. Sedentary lifestyle, until and unless you increase your metabolic rate, this calories will not, reduced calories will not help you in weight loss after certain age. Okay. Next, anemia. Mild anemia is very common in all the elderlies. Okay. And for that, iron supplements will be required. And if you're taking iron supplements, take it along with vitamin C. And if there was any history of blood loss, iron supplements has to be given. Impaired iron absorption could be one of the reasons why old age people are suffering from anemia. Yeah, in old textbook, I don't think so formula is given. That's the reason why I have explained it here. Pernicious anemia. Pernicious anemia is the type of anemia in which the pernicious cells of your stomach, okay, they deteriorate because of peptic ulcer or aging factors, and intrinsic factors are not being secreted by the stomach, and that leads to the malabsorption of vitamin B12 and iron. Okay, so that's how you get a pernicious anemia. That is the reason being your parietal cells that are present in the stomach are not functioning properly. They are not secreting intrinsic factor required for the iron absorption and B12 absorption. Okay, so that leads to anemia. Then malnutrition, poverty, inability to move, nobody to take care of. Okay, and these are one of the reasons why malnutrition can take place, and multiple medication, social isolation, not having adequate knowledge about medications and what food to have, not having that adequate knowledge on what kind of meals they should prepare for the old age. So these all are the reasons what leads to malnutrition in old age. Constipation, lack of water intake, dehydration, lack of fiber intake in food, and regular aging process which slows down your peristalsis movement. That also leads to constipation. Bloating, feeling of bloatingness, issues with flatulence. Okay. So if you eat your meals at regular time on a daily basis, drink a lot of water, exercise daily, include a lot of fiber rich food, at least 40 gram of fiber on a daily basis. Okay, that will solve the issues of constipation. And if it is still not solved, then you can go for laxatives under prescription. Okay, but for old age people, it's better, at least if you are not able to add other fiber, just have one whole cucumber on a daily basis. One whole cucumber on a daily basis is more than enough for your fiber intake. Half a cucumber for lunch, half a cucumber for dinner. Okay, that will be completely fine for your fiber intake. Nowadays, the new generation iron supplements that you get is much more well tolerated. Okay, the earlier generation of iron supplements were the ones that gave a lot of issues like constipation, black tarry stools, nausea, vomiting when you take it in an empty stomach. But the new generation iron supplements are much better tolerated in terms of the side effects. Immunity declines over a period of time, that we have discussed earlier. Have zinc supplements, vitamin E rich food, vitamin E supplements, vitamin K supplements. Okay, vitamin C as well for wound healing, collagen production. So this will improve your immunity. Dehydration, at least 2 liters of water on a daily basis should be taken, which also includes the fluid through your milk, fruit juices, pot riches, soup. Okay, including all that, the total water intake should be between 2 to 3 liters. At least 2 to 2.5 liters should be taken. Alcoholism, try to reduce. Light to moderate alcohol consumption is still okay, but try to reduce the alcohol consumption as much as possible. Just for the sake of a healthier heart, you do not have to start having alcohol. Please remember that. Just for the sake of having a healthy heart or to have a lower risk of heart disease, we don't suggest you to start consuming alcohol. No doctor will ever suggest you to start consuming alcohol just because there are some studies done that it lowers the risk of heart diseases. Okay, if you are non-alcoholic, if you do not drink alcohol at all, it's well and good. You can maintain that as it is. Okay, but if you are someone who do drink quite often, so for them you can reduce your alcohol consumption to less than moderate level consumption. That would be better for your heart health than over consumption. Okay, but no, in no way or in no reasoning we will ever tell a person who does not drink alcohol at all to start drinking alcohol to lower the risk of heart diseases. That is not the way of how health works. Okay, red wine is good. 100 ml of red wine on a daily basis is good, but it does not mean that those who are non-alcoholics, they have to start drinking red wine just for the sake of reducing the risk of heart diseases. There are other various evidence-based evidence-based food nutrition science is present, which is much better than red wine consumption, which can still give you a healthy heart and a healthy life. Okay. Certain degenerative diseases that takes place over a period of time, cardiovascular diseases like atherosclerosis, in which cholesterol gets accumulated in your blood vessels over a period of time. It leads to blockage of your coronary arteries. Coronary arteries are more impacted by atherosclerosis than any other arteries. Okay, so your coronary vessels are impacted by atherosclerosis, that is blockage in the heart vessels. Renal, your glomerular filtration rate decreases more than 60% when you age. So that leads to nephropathy, that is your deteriorating kidney health. Kidney tissues undergo degeneration. Your eye, Risk of cataract, clouding of your eyes, or it becomes opaque. Your eye lens becomes opaque. When something is opaque, it does not allow the light to pass through. That is cataract, clouding of the eye lens. So that is why this opacity is taking place, because free radicals are damaging your healthy eye lens. Okay, an antioxidant rich diet can prevent this to an extent. Specifically, a beta carotene rich diet, vitamin A rich diet, can prevent cataract to an extent. It will not cure it. It can prevent the risk of cataract. Cancer, the risk of cancer increases with age. So people who have high antioxidant intake are less likely to develop certain cancers. Certain cancers runs in the family. It's genetic. Okay. Even if you have a high antioxidant rich diet, sometimes your family genes may overshadow your diet. Okay. So certain cancers, people who have a high antioxidant rich diet, they are protected by that diet from certain cancers. But cancers like breast cancer, ovarian cancer, okay, any uterine cancers among females, these run through the family. Okay, so they do not have much antioxidant rich diet, do not have much protection against these cancers. Changes in the skin, damage to collagen fiber network under the skin. You can improve your collagen fibers by taking more vitamin C rich food, antioxidant rich food. So that can reduce the appearance of fine lines and wrinkles, discoloration, pigmentation, melasma that happens with age. Then we have Alzheimer's. So Alzheimer's is a disease condition in which progresses, okay? And certain link that has been found between vitamin K and Alzheimer's, vitamin K deficiency in Alzheimer's. So if there is a high calorie diet and if the person is deficient in folic acid, it increases the risk of Alzheimer's disease as well as Parkinson's disease. So supplementation of vitamin B complex like B6, B12, folic acid are helpful for people who has a risk of Alzheimer's in their family or Parkinson's in their family. Reducing the calorie intake, controlling the calorie intake is also helpful. So there is a link that they have found that people who take Mediterranean diet, which emphasizes more on fruits, vegetables, olive oil, fish, meat, okay, and they take very less red meat. They eat more fish and poultry, very less red meat. So people who are used to Mediterranean diet, there is a lower risk of Alzheimer's seen there. Okay, because the food naturally has high level of fatty acids, high level of DHA in the blood. So they also have a less risk of developing Alzheimer's or dementia as well. So in Alzheimer's, certain symptoms that start as confusion with time and location, they withdraw themselves from social activity. They what tasks they used to do on a daily basis, now they find it very difficult to understand and complete it. Solving problems, for example, counting cash, okay, counting cash or counting money. They will sit and count a small stash of cash for hours and hours together, but they are not able to reach the conclusion to the sum. Okay, loss of memory, misplacing items, not having a good judgment of the time and place, what to say, where, when, how to react. Okay, unfound emotions, they do not know how to deal with a cascade of emotions that they may be facing from. Difficulty with words, what to say. If they want something, they completely forget the item's name, what they want, and they be just clubbering around, but they are not able to find that word. Troubles with images and spaces. Okay, these are certain symptoms of Alzheimer's. Parkinson's usually start with a pill rolling symptom. Pill rolling symptom means if you notice any elderly who are just rolling their thumb and their index finger, okay, without their notice, they are not noticing anything. They are They may be doing something, they may be thinking something, but it is a pin rolling kind of a symptom that happens. Usually it starts like that. Parkinson's will start like that. Then slowly it progresses, okay? And slowly it progresses to tremor. The hands are shivering without any reason. It's not cold out there. The person is not anxious at all, but the hands are shivering, okay? And slowly it goes into a stage of rigidity, lack of facial expressions. They may be feeling angry or something. They may be what they are feeling. It is not shown on their face because the face also shows rigidity. Postural instability. They are not able to even to wear their own footwear. Okay, they are not. They find it difficult to wear even their own footwear. Okay, the bradykinesia is very slow walk, slow and sluggish walk. So these are few of the symptoms of Parkinson's disease. Next we have stress. People who are stressed quite often, they show a lot of premature aging. Okay, people who work in a very stressful environment, they also look much older than what their actual age is. So stress plays a physiological as well as a psychological. It has an impact on both the physiological and no, both the diseases are not same. They are completely different diseases. But both these diseases are associated with a diet which lacks in antioxidants, vitamin B complexes. So those who live in a very stressful kind of a work life, they should also intake a lot of antioxidants in your diet. Multivitamin supplements can also help them. Depression also leads to weight loss or weight gain. It can be both. Boredom, lack of interest, no purpose in life, lack of purpose in doing the daily routine, memory problems. So people who have deficiency of folate or vitamin B12, they have a higher risk of developing depression. Drugs and supplements. Elderly are more likely to take more drugs for a longer period of time to treat their chronic diseases. So these drugs may interfere with nutrition as well. Okay, to a certain extent, the absorption of nutrition may be hampered by these drugs that they're taking from a very long time. So these drug action can alter the digestion, absorption, distribution, metabolism, and even the excretion of certain nutrition and drug. The way how toxins are detoxified from the body, these drugs can also impact that. The health of the liver, the health of the kidney over a long period of time, if they're dependent on certain drugs, it can have certain effects on these organs as well. So multivitamin and mineral supplements, along with if a person is suffering from a chronic disease and if they are taking certain medications for a pretty long time, in that situations, having multivitamins and mineral supplements is recommended. Whey protein supplements is also better for older people. Physical activity, you can read about it. It's always like it's a self-reading topic about physical activity. What kind of exercises, what is the benefit of exercises. At least 30 minutes of brisk walking or any